So good afternoon, everyone. I'm going to be talking about lasers for nail psoriasis. So just a little bit about nail psoriasis. It's a very common condition, and it affects over 50% of plaque psoriasis patients, and lifetime incidence is 80 to 90%. It affects both the nail bed and matrix, and it can cause varied symptoms, as you can see in the table. A common assessment tool for the severity of nail psoriasis is the Nail Psoriasis Severity Index, aka NAPSI, and you'll hear me talk about that in a little bit. And treatments include topicals, intralesional injections, and systemic therapy. So lasers are emerging as a very promising option for treating nail psoriasis. They offer improved nail penetration and precision. So lasers being used include vascular lasers, such as the pulse dye laser and Nd:YAG laser, and those work by destroying the vasculature of psoriasis lesions. The newest laser being used is the fractional carbon dioxide laser, and it's been used for laser-assisted drug delivery, and it creates microscopic thermal destruction zones to allow better penetration of a topical medication. So our objective was to review the efficacy and safety of laser therapies for nail psoriasis treatment, and we searched 4 databases and found 23 studies. A majority of the studies were on the PDL. So for the PDL, it resulted in significant NAPSI score reductions in all studies except for one, and this was a study comparing it to CalBD foam, or calcipotriol betamethasone foam. The authors said that this may be due to the fact that they had a reduced number of treatment sessions with the PDL, and they only used 3 sessions. Some things to note: it has high patient satisfaction with minimal side effects such as transient purpura and mild pain. It has mixed efficacy regarding the nail bed versus the nail matrix. A majority of studies said the PDL improved the nail bed more than the nail matrix. However, there were a few studies that said the opposite. Importantly, the longer pulse duration was associated with more pain. This is due to deeper penetration. The excimer laser was not effective for nail psoriasis, and this is thought to be because the wavelength of the excimer is within the UVB light range, and that exhibits limited nail plate penetration. And the intralesional injection of steroids, ILIS, had quicker improvement than the PDL in patients. However, by the end of the trial, there was equal efficacy. For the long pulse 1064 Nd:YAG laser, there's a lot of mixed evidence. One study reported, a single arm trial reported that there was complete NAPSI score reductions in the nail bed and the nail matrix and overall. However, another study came out, and this was a controlled trial, and they said that there was only significant improvements in the nail bed and total NAPSI. And then another study came out and said that there was only improvements in the nail matrix. So there's a lot of mixed evidence. It's not really, we're not really sure what happened there, but the author of the study about the nail matrix improvement said that this may be due to them using a higher fluence and a smaller spot size. And comparing the Nd:YAG to the PDL, both had equal efficacy, and the authors of those studies said that they would recommend the PDL over the Nd:YAG due to the fact that it was associated with significantly less pain. For the fractional carbon dioxide laser, we have consistent efficacy in reducing NAPSI scores, particularly for the nail matrix and pitting, which is the most common nail psoriasis feature. There's high patient satisfaction with a little bit more side effects than the PDL and Nd:YAG, and that includes mild bleeding and mild to moderate pain. As you can see, some things to note: there was only one study that actually explored FCL monotherapy, so we need more studies on that. But a weird kind of concept, but fractional carbon dioxide laser and the CalBD ointment was not better than the FCL alone. So that may imply that the ointment is not that effective. However, FCL plus CalBD foam was not more effective than CalBD foam. So that raises the question whether or not FCL needs to be added when treating a patient with CalBD foam. Another thing to note is that FCL plus a topical agent was less painful than intralesional injections, and that's similar to the PDL. So conclusion, laser considerations, the Nd:YAG has limited evidence, and the evidence that we do have is varied. So many authors did not recommend it at this time. When choosing between the PDL and the FCL, it's important to consider the patient. Patients who are non-adherent to daily therapy or simply don't want to apply a topical, PDL is going to be a great option, and there's a lot of evidence, or a lot more evidence supporting its use as a monotherapy. However, if a patient is primarily complaining about pitting or nail matrix features, they will probably benefit from the FCL because it has remarkable efficacy in that area. General treatment considerations, while intralesional injections and topicals are low cost, they have their disadvantages. For example, injections are painful, and the topical medications have limited nail penetration and poor adherence. Lasers are higher cost, but they have enhanced topical penetration and high patient satisfaction. Limitations, there was a variation in the study designs and small sample sizes that limit definitive conclusions, and future research should focus on fine-tuning laser parameters, evaluating long-term outcomes, and exploring different laser modalities. Importantly, there needs to be more comparative studies between the lasers and between typical nail psoriasis treatments. And these are my references. And then I just want to thank Dr. Nori and my other research fellows that helped me out with this. Thank you.